Welcome to Global Patient Services at Cleveland Clinic. In the United States, the average length of stay for patients admitted to the hospital is only 5 days. It is possible that some patients discharged from the hospital at Cleveland Clinic need additional medical care and are moved to another facility where care continues. We look forward to making your visit pleasant and efficient so you can return home as soon as possible. There are several areas that need your attention as you prepare for your trip. Before you depart for Cleveland, it's important to give some thought as to how you'll return home immediately after your discharge from either the hospital or when your treatment ends. In preparation for your trip, it's imperative that you bring a copy of all your medical records translated to English, such as a list of current medications, biopsies, a disc of any imaging, and x-rays. In addition, you must bring your valid passport and a passport for anyone else that will be traveling with you. This will avoid significant delays in the registration process. If you will require kidney dialysis upon arrival at Cleveland Clinic, please inform your embassy before you leave home so they can make arrangements with the regional liaison at Global Patient Services. If you will need to travel with oxygen or a wheelchair, please make arrangements with your personal physician to obtain these items several weeks before your trip. Also, tell your embassy you're traveling with oxygen. They'll inform your regional liaison, who will make an appointment for additional oxygen upon your arrival. And finally, kindly contact your embassy for transportation information from Cleveland Hopkins International Airport to your hotel. We're happy to assist you as you prepare for your medical care at Cleveland Clinic. If you have any questions before you leave home, please contact your embassy. When your plane lands in Cleveland, Ohio, proceed to the baggage claim area and then follow the recommendation given by your embassy. Upon your arrival at Cleveland Clinic, your first appointment will be registration at Global Patient Services, located on the 3rd floor of the Intercontinental Hotel. You will check in at the front desk and then meet one of our regional liaisons. Please bring your passport and your airline tickets to this appointment. As part of the registration process, you may need to consult with the finance department, which is also located in Global Patient Services. Your medical, financial, and personal privacy is the highest priority to us, and your information will remain private and secure. We want your arrival to be as seamless as possible so you can concentrate on your health. If you have any questions or concerns, please let us know. Cleveland Clinic Global Patient Services has a dedicated team of liaisons who will assist you. These liaisons are employees of Cleveland Clinic and not employees of your embassy. Cleveland Clinic is obligated to provide you with complimentary interpretive services. In the absence of a live interpreter, some form of interpretation will be provided through the use of technology. Please understand that family members are not permitted to interpret any medical dialogue between you and our healthcare professionals. Global Patient Service liaisons will facilitate in scheduling your appointments and provide your embassy with your bank account information. They will coordinate the scheduling of follow-up appointments while you're in Cleveland and notify you of the time and location. For appointments outside of your initial diagnosis, Global Patient Services must obtain prior authorization from your embassy to schedule. Liaisons will also contact your embassy to obtain pre-approval on additional services you might need, such as medication refills or post-hospital care after your discharge from Cleveland Clinic. We will keep the embassy updated on your medical progress. In case you need to extend your legal stay in the United States, a liaison will request a letter confirming that you're currently receiving medical treatment at Cleveland Clinic. You will include this letter with your petition to United States Citizenship and Immigration Services. You have certain responsibilities as a Cleveland Clinic patient. If at any time you cannot go to a medical appointment, you must contact your Global Patient Services coordinator immediately to cancel and reschedule the appointment. Your embassy will be notified of any change in appointment or cancellation. This may affect your coverage and delay your treatment. Global Patient Services liaisons are Cleveland Clinic employees and not embassy employees. Therefore, you are responsible for contacting your embassy directly if you need help with information related to your monthly allowance, health coverage for your companion or escort, passport renewal, and notarization of clinical documents. It is also your responsibility to contact your embassy to coordinate travel arrangements to your home country after your discharge from Cleveland Clinic and coordinate your follow-up in your home country. If at any time you have questions, please contact your embassy for clarification. During your medical appointments at Cleveland Clinic, you may see a healthcare provider in an outpatient clinic. An interpreter will be present to assist you with all medical interpretation. You're encouraged to ask your healthcare provider questions such as, what tests are being done and why? When will I get the results? What is the treatment plan? What kind of medication am I getting? When is my next appointment? And how do I take my medications? If you're having surgery at Cleveland Clinic, please note this very important information. Some blood thinners must be discontinued before surgery. If you're on a blood thinner, tell your GPS coordinator, who will then contact the clinical team to find out if you need to get off your blood thinner. Failure to stop certain blood thinners on time will result in the cancellation and delay of your targeted surgery date. If you have medical films or CDs, you must bring them to your pre-surgery appointments. Without these films or CDs, surgery preparation cannot be done. It's important that you do not miss any appointments, including pre-surgery testing and related appointments. Missed appointments will cause a delay or postponement of your surgery date. You may even need additional blood work, since it may expire by the time your new surgery date is scheduled. If your medical condition requires you to stay in the hospital, you can expect continued communication with your team of doctors, nurses, care managers, and dietitians. Again, interpretive services will be provided at all times, so you're able to communicate with them. Your embassy will cover the cost of a private hospital room if one is available. Each hospital room is equipped with a phone for local communication, television, and Wi-Fi access. Visitors are welcome anytime. However, they must have a picture ID to obtain a visitor badge. During visitation, we ask that you and your guests maintain a low conversational tone out of respect for nearby patients. Many independent restaurants are located throughout Cleveland Clinic's main campus, and a large cafeteria offering culturally diverse cuisines can be found on the first floor of the H Building. If you're admitted to a private room, personal meal service is included and delivered to your bedside. If you have any questions or concerns about your medical appointments or hospital stay, please contact your Global Patient Services Coordinator. During your hospital stay at Cleveland Clinic, you will receive world-class care from your medical team. When your doctor is confident you're ready to leave the hospital, you will be given discharge papers. You are then required to leave Cleveland Clinic that same day to prevent infections and other medical complications. It is possible that in order to achieve full recovery, you will require additional medical care in a post-hospital care facility that is not part of Cleveland Clinic. The post-hospital care facility will bill separately for their services, and a liaison will contact your embassy for approval. Once medically approved, your doctor will recommend which facility or services best meet your medical needs, and you will be transported there. Although this facility may not be owned by Cleveland Clinic, it will follow the care plan written by your Cleveland Clinic medical team and remain in constant communication with them. It is important that you participate with the facility's team of highly educated and trained therapists to ensure your recovery and independence. Family members can visit at any time, and interpretive services are available at all of the post-hospital facilities. As healing improves, you will require less doctor visits and medical attention. During this time, you will practice taking care of yourself in preparation for your return home. Your Cleveland Clinic doctor will monitor your progress and determine when you are well enough to leave. Once again, when the discharge papers are signed by your doctor, you are required to immediately leave the facility. You will contact your embassy to initiate your travel arrangements. When you arrive back home, it is recommended that you follow up with your local primary care physician. Your health is important to us. The Global Patient Services team is here to answer your questions and support you. Our goal is to help you recover quickly so you can return to your family and friends in your home country. Thank you for choosing Cleveland Clinic for all your medical needs.